and welcome. You're watching Health and Wellness Save a Life. Every life is indeed invaluable and precious. The problem of a sudden cardiac death is a major concern all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to the sudden change in lifestyle and food choices that are available. When medical emergencies like cardiac arrest happen around a person, it is important to be prepared. If you're aware and informed, then you can take steps to revive a person and therefore save a life. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation, or CPR as it's popularly known. Many adults in cardiac arrest can be revived with intact neurological function if the bystander can provide immediate CPR. Raising public awareness, therefore, and an understanding of practical implementations of CPR is an essential strategy to increase CPR success in cardiac arrest cases. It is even more important to learn about CPR if you have a loved one who has a history of cardiac disease, as research reports that a majority of cardiac arrests occur at home. Save a Life is an initiative through which people can be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We have with us Dr. Professor KMK Reddy, Senior Interventional Cardiologist, Senior Consultant, Apollo Hospital, Ramya Heart Center, Hyderabad. We also have Dr. Sandeep Kadam, Dr. Kadam Heart Clinic and Diagnostic Center, Pune, Dr. Manbir Singh Khurana, Senior Interventional Cardiologist, Ludhiana Mediways Hospital. Thank you very much, doctors, for being with us. Dr. Reddy, to you first, what does the term heart failure actually mean? And does it mean that the heart is essentially stopped working? Can heart failure cause sudden cardiac arrest?
Yeah, heart failure basically is weakening of the heart. It is not necessary to be a complete stoppage of the heart, but it is basically a weakening of the heart, which is not able to cope up the demands of the body. So when the heart is pumping at a lower capacity, lower than the expected or the lower than the demand, then we call it as a failing heart. Failing heart is a tired heart which is not able to cope up the demands on a regular basis.
Dr. Kadam, people around the age group of 30 to 40 years of age also suffer heart attacks and have severe heart problems. What is the main cause of a steep increase in heart problems among younger people?
Actually, India is a hub of diabetes, first thing. So diabetes is major risk factor for the heart disease. If you see the all young peoples in India, typically the age less than 40 people have more chances of heart issues, mainly the heart attack. Again, the chances of getting multiple blockages is very common. Again, the hereditary is also common. Second most common thing is the COVID. After COVID, there is a hypercoagulable state, and that leads to the clot formation and heart attack. Third is the sedentary lifestyle. Because of lockdown, and especially in the IT sectors where they working from home from say morning 8 to till night, and sitting on in front of laptop without any activity. So that leads to again a risk factor. Other factors like smoking, high cholesterol, which are usual one, and sedentary lifestyle. So all these together leads to the more, and most important is the awareness. Now there is a early detection of the symptoms and diagnosis, which was not 10 or 15 years before. So all this contributes to the major issue with the young peoples.
Right, Dr. Khurana, in that case, can sudden cardiac death in younger people be prevented? And are there any early signs or symptoms which people may pay attention to so that they can take preventive steps?
Yes, a sudden cardiac death can be prevented by taking various precautions, as our colleague previously said. That one is smoking cessation, which can actually prevent cardiac death by many folds. The people who, if they quit smoking, then is having a balanced diet that is rich in the protein, fiber, and less of carbs and fats. And then going for a regular checkup is very important because many things are diagnosed after a routine checkup. And the most important thing is, if we are planning, if a youngster is planning for a very extreme activity, like he's planning to go for a gym and going for a very strenuous sports activity, he should get himself checked before his physician, that he get his simple basic tests, because sometimes these things can be diagnosed by basic tests. And if we have seen that while doing extreme activities like in gym, young patients suffer from cardiac arrest, and if they get them checked up before doing these activities, it can be prevented. And then is if you have any strong family history of sudden cardiac death, like if your younger siblings or somebody who has less age, like has died suddenly while sleeping, or we don't know what's the cause of death, if it is there in the family, then definitely screening of all the family relatives, first degree relatives, should be done by a cardiologist by getting a simple ECG and echo done. And because sometimes these diseases are silent, and they can be diagnosed by screening only. And if the patient is already a cardiac patient, he has, as sir said, that he has heart failure and heart is weak, then in these patients there is a device called AICD, implantable cardioverter defibrillator. It can be put, and it can prevent this sudden cardiac arrest by giving a shock. So all these factors actually help to prevent the sudden cardiac death.
Right. Dr. Reddy, we all know that feeling constantly stressed could increase the risk of heart and circulatory disease. How does acute stress lead to sudden cardiac death?
Yeah. See, the stressful life, a chronic stress, is definitely a risk factor. It is proven in a good number of large studies also. So, stress basically increases the catecholamine surge, and it definitely causes some sympathetic overactivity in the body, and which in turn causes many cardiovascular changes in the body. Therefore, they are the people who have already having a chronic stress, or sometimes precipitated by an acute stress, they are prone for sudden issues like a heart stroke or a heart attack. So basically, this is happening because the overactivity in the sympathetic system, that is causing a heart rate high, and the high heart rates are not good for a longer duration. Definitely, it has a negative cardiovascular issues that are likely to happen. Therefore, the important thing is for a country like in India, more so in a younger population, that is the youth of the India, should be a divide of a stress if possible, or a stress management has to be done in a proper scientific platform. And everybody, I suggest the stress management or avoiding a stress is the important thing, because it is catastrophic to the heart.
Right. Dr. Kadam, what's the first thing you should do when you see someone go into cardiac arrest?
First thing, you need to call for the help. Start CPR. The chest compression, it should be at the rate of 100 per minute, and it should be 2.5 inches, what we call as a high quality CPR. And you should give a breath after every 30 compressions. And most important is allow the recoil of the chest. So you should take a proper high quality CPR training, and that should be continued till the other teams or medical help receive. The most important thing, this CPR training should be done from the school level. I think we should include it from standard 8 or standard 9, which is good options to educate the people, and that will prevent lots of life and lots of death.
All right, very important points there. Dr. Khurana, what are some of the important points to remember while performing hands-only CPR?
Yes, there are two very important points. First is we should make sure that the scene is safe. Where we are performing the CPR, there is no major risk to the person who is giving the CPR as well as the patient, because sometimes there is glass or sometimes it's the place of accident. So sometimes you can cause harm. So you should bring the person to a safe site. And then is we should see whether actually the patient is breathing. The normal rhythmic breathing should be there, and we should check for the responsiveness of the patient. Sometimes the patient is just lying unconscious. We should tap the shoulders and check whether and ask whether the patient is responding or not. And after that we should call for an assistance and then immediately start with the hands on only CPR. For the hands only CPR, we should kneel beside the person who needs help. We should be kneeling on our and our heel of our hand should be kept at the center of the chest, and above that our another hand should be kept, and the fingers should be interlaced. This point should be kept at the center of the chest, and the compression should be started as Dr. Kadam said. It should be done properly, and we should allow a proper recoil, that is 2.5 inches deep and around 100 times in a minute. So we should continue it till the help arrives, and it's very important to start it as early as possible. Yeah.
All right, important points being made there. We're going to slip into a very short break, but our panel of experts will be live with us on the other side. Stay tuned. Welcome back. You're watching Health and Wellness Save a Life. Well, Dr. Reddy, if I can come to you, it's generally believed that CPR should be performed for every unconscious person. Is that true? And are there any sort of situations when one should not perform CPR?
Yeah. See, as our Dr. Singh has told, basically any unresponsive patient, if he is found to be breathing, or we can check by just putting the finger under the nose, and we can check whether somebody is breathing or not. Somebody is found to be unresponsive, like a collapse in front of our eyes, or somebody is just like that as a stranger. When we find somebody very unresponsive, we have to start CPR until otherwise somebody is declared or found to be clearly dead. In the sense, there is no breathing for an individual. Probably if somebody has seen him or observed him for like more than 3 minutes, not at all breathing, in that scenario, the doing a CPR is going to be an in vain thing. But if we are suspicious of whether the duration of the cessation of the respiration or the heart, for a benefit of doubt always to the individual, we have to be very, very liberal in giving a CPR, because CPR is a life-saving one. There are many people who can be made as survivors by doing an effective, timely, appropriate CPR. Therefore, by not doing a CPR, probably by without having a proper knowledge, it is sometimes dangerous. Probably the candidate may be a deserving candidate who would have survived him. So therefore, I strongly believe that a CPR, there should not be any hesitation to do a CPR. But if somebody is already dead, very clearly, there is no breathing, stoppage of, there is no pulse, absolutely, no, even the cardiac pulse is not there. It's completely dead, at least for our observation, like 5 minutes or 4 minutes we have seen. There is no point in doing a CPR for such an individual. But important point I want to tell is probably better to have a positive attitude to do a good CPR, so that I think we can make a life better, and we can save many lives for our fellow colleagues.
Right. Dr. Kadam, are there any precautions people with heart diseases should take to prevent having an episode of a sudden cardiac arrest?
The most important is they should be regular with their medicines. If a patient who undergone for any heart surgery or angioplasty or any other surgery, he should take the blood thinners according to the cardiologist's opinion, and they should not be stopped on its own. Many times what happens, these people stop the medicines, blood thinners, and that leads to the catastrophe, and then things get worse. So this is most important thing. Second is regular health checkup. Regular health checkup, there are some parameters that should be taken into the consideration, like ECG, two-dimensional echocardiography, and stress test, and some blood tests like cholesterol test, some cardiac risk marker tests that should be regularly check up. So all these things prevent the second episodes. And first and most important thing, do not diagnose this on your own. Many patients lost their life just because they diagnosed this chest pain could be because of acidity. I came across at least 100 person who diagnosed themselves that it's acidity. They came to emergency and they found to have a heart attack. So heart attack pain is a classical pain. It's a red flag you never experience in your life. First time in the life, it's a kind of severe pain. It can be there from jaw to the upper abdomen in the right shoulder or left shoulder, on the front side or back. So it's not that it's a left hand pain or left sided chest pain is a heart attack pain. Heart attack pain can be anywhere in this area. Second thing is the uneasiness. Third is the sweating episode. All these together need a emergency or urgent health, medical checkup. So be regular on the medicines, health checkups, and follow the instruction of your cardiologist. That will prevent the further events.
Right. Dr. Khurana, the lack of CPR awareness is a big health challenge in India. Please tell our viewers why it's essential for people to learn CPR.
So actually, a lot of data is there, and a lot of studies have shown that most of the cardiac arrests occur out of the hospital. And in India, only more than 7 lakh patients every year die of cardiac arrest. And it is the initial few minutes of this cardiac arrest where there is some time. There is some time when we artificially pump the heart by this CPR. It gives blood to our vital organs like brain, kidneys, and liver and lungs. So basically, we are perfusing these organs artificially by performing a CPR. And if we do that in initial 2-3 minutes and as early as possible, we can definitely make a lot of difference. Rather, we can save almost half of these lives if the CPR is done on time and properly. That is a high quality CPR. But unfortunately, in our country, the awareness is very less for this CPR. People don't even know what's the full form of CPR. It's cardiopulmonary resuscitation. The problem is it is not being taught in the schools. As Dr. Kadam said, it should be inculcated in our regular curriculum. Every child should know from the beginning how to perform CPR. And if there is some patient in your family who has a heart disease, you should be aware of performing a CPR. It is a very simple process, and a lot of videos are present on the YouTube. There is a video by American Heart Association. There is a lot of material on internet where you can easily learn how to perform this CPR, and we can actually make a lot of difference by giving a high quality CPR at a time when it's actually required.
Right. Dr. Reddy, what are the treatment options available for sudden cardiac arrest?
Yeah. Sudden cardiac arrest basically is secondary to many diseases. See, sudden cardiac arrest is not a disease, it is an event. It is happening most of the times is secondary to heart attack, but not necessary to be only heart attack. Heart attack is one of the reasons, or without heart attack, people can have sudden cardiac arrest because of various problems. So treatment option is basically determined by the cause of the sudden cardiac arrest. So once an individual is found to have some disease and probably a potential candidate for the sudden cardiac arrest, those cause should be treated. Like if there is a valve stenosis, like an aortic valve. So when there is a valve stenosis, probably better to treat the valve stenosis rather than treating the sudden cardiac arrest. Sudden cardiac arrest is an event. So therefore, if there is a heart attack, probably heart attack has to be treated by mobilizing the patient after doing a CPR or if required, or a first aid, mobilize the patient to the nearby ICU or a cardiac center where the facilities are there. Probably the heart attack can be managed either sometimes with a medicine, sometimes with a immediate shifting the patient to the cath lab and doing an intervention, like probably after doing a diagnostic angiography. Sometimes we may choose to go for a immediate intervention or even immediate angioplasty, or probably we can do even emergency CABG also, a bypass operation. So there are various options even for the so-called heart attack. But if it is not caused by the heart attack, the options will be definitely many, like a valve replacement is sometimes, or probably treating an arrhythmia. There are some dangerous arrhythmias, primarily without any structural heart disease. The primary arrhythmias also can take somebody's life and produce sudden cardiac arrest. Therefore, the cause treatment or the treatment of the cause is most important.
All right. Well, I'm afraid we're out of time and we'll have to leave it at that. Thank you very much, doctors, for joining us.